and now recognize the gentlelady from Washington, Dr. Schrier.
Thank you. Thank you, Chairman Griffith, and thank you to the witnesses for being here today. I appreciate all the work you have done over the past few years with a rapidly changing pandemic and tricky messaging. We have learned a lot in these past few years, and I just want to make sure that we remember these lessons when the next public health challenge comes along. Today, there's a lot to talk about, but I'd like to focus on testing and on therapeutics. So, Dr. Califf, in your testimony, you say that the FDA is committed to continuing to use every tool in our toolbox to fight this pandemic, and I absolutely agree. As a pediatrician, I've been advocating, now we're talking years, for the use of rapid tests and masks and a multi-layered approach to keep our kids and families safe and to keep our children in school, in classrooms. And I also just want to acknowledge, Dr. Walensky, thank you for you also having that as your North Star. How can we get our children into classrooms and keep them and their teachers there safely? In fact, we did one of the first pilots in the country on using rapid tests to get kids into school. The FDA has authorized over 30 over-the-counter tests, and I use them before I travel home to make sure I'm not bringing unwanted COVID back to my family. People use them around the holidays to protect their families, and we've really come to rely on these rapid tests. Are any of the ones that we're using today fully authorized, or are they all under emergency use authorization?
I believe all of the rapid tests that we have today are under EUA, but they will not go away because we'll have a bridging program, and they will still be available.
That is fantastic.
I'll have to check to be sure it's 100%.
Okay, I wanted to make sure that that would happen because they're really indispensable. I will hop to my other topic. Mr. Tabak, or Dr. Tabak, excuse me, the RADx program has been incredible. These public-private partnerships, getting accelerated treatments has been incredible. I was wondering if you could talk about how we are going to use this and stay nimble with future threats, but just kind of a briefer answer because I have more for you.
So from the lessons learned, we know that if we could create centers that are ready to take very rapidly the problem, find a solution, and then scale it up, that we could make a big difference in any future pandemic.
That public-private partnership has really been incredible, and I appreciate the work in all of these institutions, CDC, ASPR, BARDA. We've already seen with COVID that as the virus has changed, some of our therapeutics are no longer useful, like some of the monoclonal antibodies. And we know from our experience with TB and with HIV that we may get to the point where what we need are drug cocktails. Essentially, you don't just use one therapeutic in order to evade all of the mutations and changes in a virus and them getting around therapeutics. We may need to use several at once. There's not a lot of incentive for drug companies to do that testing. And I was wondering if you could talk about what is happening at the NIH to speed drug cocktails.
So in the ACTIVE program, which is a public-private partnership consortium between government agencies and industry, we have in fact used that as an incubator for these types of mix and match, if you will, types of approaches. And we've been very pleased for a number of our industry colleagues who've come forward and have been willing, to engage in this sort of conversation. So I think that's the direction that we'll have to proceed in the future.
That's fantastic. And frankly, they will have more of a guarantee of a long market life if they figure out how to make theirs more effective in a cocktail. Last question, Dr. Califf. I know there's been a lot of discussion about whether vaccines are still useful, even if they are not perfect at preventing the disease or perfect at preventing transmission. I just wanted to give you an opportunity to set the record straight on your perception of the importance of vaccines.
Really, first of all, let me just speak to the transmission issue, which has been discussed very much today. It's true that the vaccines are not sterilizing, and Dr. Bouchon, I think, was careful in using that word. What we have, though, is a modest prevention, like a 50% prevention of risk of getting infected if you're up to date on your vaccination. And that's very important for frontline workers of all types to stay healthy, for children not to infect their grandparents who may be at risk. But the most important thing, I think, is if you're up to date, you've gotten your bivalent now, which is what that means, your risk of dying if you get infected is reduced by 80%. And if you get a antiviral that's recommended by the FDA, if you get infected and you're high risk, you have another 80% reduction. Now you have to do contingent probability, so what that means is your risk of dying is very low if you get both. So, you know, I'm a cardiologist, so I'm used to life and death. This is like the most important thing one can do today to keep from dying that's very remediable, free. There are side effects to vaccines, we all know that, but they're far overwhelmed by the benefits that
Thank
occur.
you. As a pediatrician, I fully concur with the importance of vaccines. I yield back.
Gentlelady yields back.